This podcast is for the head and neck assessment. An acute assessment, whenever there are head injuries or neurologic changes, is considered an emergency and urgent. So you're going to do a focused assessment on the head and the neck. If there is any unexplained neck pain, you want to do an assessment. The only thing we're going to be doing with the neck is checking to see if we can palpate any lymph nodes that are larger than 1 centimeter. Are they fixed? Are they regular? Irregular? Are they hard? Are they rubbery? And that's pretty much all you're going to have to do for the neck. Subjective data. You want to ask your patients about the risk reduction and health promotion. What's their occupation? Is there a risk taken at their occupation for any head or neck injuries? What are their hobbies? Do they use personal protective equipment? Pertinent goals and education topics. In class, we're going to talk about Healthy People 2020 and what some of the goals of Healthy People 2020 are related to head and neck injuries. So your subjective data collection, common head and neck symptoms such as pain. You want to do a thorough pain assessment. If there is any misshapen parts of the skull or the head, you want to note that. Lifespan considerations. Remember that older adults may have some neck pain, may be caused by some chronic illnesses. Cultural considerations. This is a photo from when I had taken students to Haiti, and there are cultures where the women do carry huge tubs on their head. A lot of times it's to carry laundry down to a river or a place of water to do their laundry, and then they carry it back on their head. So this could also promote neck and back problems. Objective data collection, we're going to use your practice rubrics for the head and neck, but basically all you're doing is inspecting. So you're going to look at the head. Is it round? Is it equal on both sides? Is the hair thick, thin? Are there patches of baldness, or is it pattern baldness? Palpation, we're going to palpate the scalp, make sure that there are no lumps, lesions, or tender areas. The temporal artery, we're going to assess that. And pulses are determined on a scale of +1 to +4. +4 would be very strong, bounding. +1 is going to be very weak. So usual is 3 or 4. And then we're going to document what we looked at. Again, we're going to practice this in class.